antiarrhythmic medication. So it's for cardiac arrest.
Yeah.
So we eventually found the house. It did take us a little moment. This neighborhood is a big neighborhood, bunch of different. I don't know. I guess you want to say. The area has a bunch of neighborhoods with different names, and those neighborhoods themselves are like huge. And then not only that, they don't have, access ways to these houses. Like it's like long roads. You gotta travel through to go in circle. Like there's nothing in the middle to cut through the neighborhoods. And so it took us a little while, couple seconds, maybe a minute, to get it to the house. But we finally found it. And when we got there, FD was already on scene. We get off. We go around, take our equipment out. Two of the FD guys walk up to us, and I asked them, what's up? Like, how's the patient look? Because I'm already thinking worst case scenario, because we got information, an 84-year-old female, chest pain, clammy, and pale, which obviously I'm thinking legit shit, right? It's heart attack. And one of the FD guys like, oh, she's okay, she's fine. There's another FD guy's checking her out. I was like, oh, okay. I mean, it's not too credible, because obviously they don't know, right? They're just EMTs, firefighters, like that, Like, okay, cool, whatever. At least she's alive. That's what I'm hearing from what he's telling me. She's alive, which is badass. So we walk in eventually, and it's a big house. But as we walk into the doorway, the bedroom that the patient's at, it's literally right next to the doorway, the main doorway. And then not only that, the halls are narrow, so we can't put the stretcher in there. So I told my partner, hey, just set up the stretcher. I turned right into the hallway and then turned right again into the bedroom. And then there's a family member, I believe it was 2 firefighters. One of them was, I think, was getting a BP. And the patient's on a medical bed, which then to me it's like, okay, she's bedridden, right? She has obviously history, medical history where she needs to be in a medical bed. And chronic illnesses, that's what I'm referring to. I make contact, I look at the patient, patient is alive, skin doesn't look pale. She was clammy, but it was more like sweatiness, maybe like a fever, right? Usually like elderly, bedridden, Pampers probably, UTI, especially elderly females or elderly patients. Not so much just females, but just elderly in itself. UTI is always considered fevers, right? And so then I make contact with the family member. I say, what's going on? They speak Spanish. I speak Spanish. So I was like, ¿qué está pasando? Which means, what's going on? And she just explains to me that, since yesterday she's been feeling bad. She's been not acting herself. And that's kind of pretty much what she told me. Like, she wasn't really like, and those who work in the field understand that you're never going to get a nice, clean report of family members. It's always either extra information or not enough. And in this case, it was not enough. And I was like, okay. So then I asked her, I was like, so I could get a normal mental status. And that's usually what you want to get from his family is like, do they normally understand? Do they normally talk? Do they understand who you are? Do they understand where they're at? Do they understand what's happening? And so she pretty much said no. She only knows her name pretty much. She has Alzheimer's. So that's one of her histories. And I asked her, well, what else does she have? She has diabetes. I believe it's diabetes, Alzheimer's, and cholesterol. And I said, okay. So then I made contact. Now I'm on the left side of the patient in the bed. And I call her name. She looks up at me and reacts to me. And then I ask her, ¿Cómo te sientes? Which means, how do you feel? And she didn't really like verbally, say anything. She just kind of like rapid breathing, right? Hyperventilating almost in a way. So then, obviously, I can't get chief complaint. So then I'm thinking, well, I can't even. I don't know how they got chest pain, but whatever. And then the firefighter then tells me, he goes, hey man, her SpO2 was at 86 room air. And I said, and he goes, I was thinking about putting her on oxygen. I was like, yeah, well, that's a good choice. I said, and that's when my partner comes in, and she goes, hey, what do you want to do? And I say, hey, well, let's put her on oxygen in the meantime while we, going to extract her onto the stretcher. And so that's when the firefighter was, I guess, looking for whatever. I walk out, go into the stretcher, kind of planning it out, like how are we going to do this? Feet first, head first, whatever, right? Set up the stretcher, come back in. I was like, you know what, dude, let's just grab the sheets and just, use the sheet and carry her onto the stretcher, which was like approximately about 8 feet, maybe. About 5 feet from the bed to the doorway, and then to the doorway to the stretcher was maybe another 3 feet. So about 8 feet or so. And so we did, right? Me and another firefighter did it. We went feet first, and then we were able to place her. We put her in full Fowler position, and we connected it nasal. My partner did ask me, what do you want, normal breather or nasal? I was like, well, let's just go with nasal first to see how she reacts. I did go at 6 liters from the doorway to the unit, which 6 liters on the nasal is the limit. And so by the time we got to the unit, I looked real quickly at the monitor because I got to work on the IV because my partner doesn't do IVs. And her SpO2 is at 94, 95. Look, great. Well, before we did move her, I did assess her lung sounds there on bed, and I did hear what sounded like bronchi. I was thinking maybe pneumonia, congestion, obviously. So maybe she's been sick. I think I did ask her if she's been sick the past couple of days. She goes, no, just since yesterday and today and whatever. I was like, okay. So I'm working an IV. I got an IV. I got a 20 gauge to the left forearm. Pretty easy IV, no struggles. I told my partner, hey, work on a monitor, put it on a 4 lead, put it on a 12 lead, and see what's up. And our first BP that we got was 117/72 with a MAP of 87, which MAP means mean arterial pressure, which is really good. Heart rate was 87, which is great too, because it was sinus tach. It was above 100, and then with respirations and then low SpO2, then obviously that's the body trying to compensate for the lack of oxygen, right? So it's okay. So I'm assuming now congestion might be the issue that's causing the low, diffusion or oxygenation, right? Because there's mucus, right? Which then I'm thinking the climminess could be fever, so I eventually gotta get a temperature, right? So then, so respirations are at 26. They were like 30s, 26. Get a sugar at 212, which is obviously pretty high. DKA, right? DKA starts at 200 and above. They get a temperature of 97.8, so we ruled out, obviously, infection is not in place. There's no fever. So the climminess is legit to the, respiratory distress call, right? So then I gave her an albuterol. I gave her a steroid, apotropium, if I'm saying it correctly. Kind of help her breathe. She went up to 100. And EKG was normal sinus rhythm. 12 lead came out normal, like surprisingly normal, thinking there was going to be something. Not even like, if I remember correctly, I don't have the strip with me anymore, but if I don't remember correctly, there was not even an axis or deviation to the axis, right, the conduction system. So everything's good. So SpO2 went up, congestion is present, no fever. I can't treat this call as a chest pain because patient can't voice, hey, I have chest pain. Then not only that, objective information, which is the 12 lead EKG, and then signs and symptoms, doesn't really support cardiac situation. So what I'm thinking was that if there was chest pain, it was induced by lack of oxygen, which then hypoxia will eventually cause the muscles to ache, right? The lactic acid, which will eventually make muscles ache, which then you'll have chest pain. This is what I'm assuming in this case. It's not really a cardiac because situation is improving with oxygen, with medication, and then objective information, the EKG and 12 lead are coming out clean. Now, does this mean she could still have a heart attack? Yes, she can, but we would have to check cardiac enzymes, which I'm limited to my tools at the time. So at this point, we're good. We transport. I gave her up to 200 mLs from when we left till we got to the hospital. From that house to the hospital is approximately about, I'd say about 15 minutes or so. She was good. She wasn't even coughing. I checked on her every so often, and it was a very clean, simple call with simple treatments. But one thing that really stood out to me was that when we were there at the hospital, when we were waiting to be triaged, a family member arrived, and which was another sister arrived and was talking to the patient, which is their mom, and the mom was much more receptive. She wasn't climbing anymore. She spoke more than one word or two words. I was even my partner was like, hey, dude, have you noticed like how her mental status improved? Like she was more like, originally I clocked her at COA times 1 to name, and then GCS of 12, 13, right? It was kind of confusing. Like, did she obey commands, or did she withdraw from pain? Localized pain or withdraw from pain. Like, it was one of those like weird, because I would tell her, hey, ma'am, can you raise your arms? And she wouldn't, right? But then she, right while I was about to touch her, she then did it, So it's kind of like, wait, did she just react to me trying to touch her, or did she had a delay of understanding what I was telling her? So it's one of those. Those are weird situations. So anyways, so I clocked her at COA times 1, name. GCS of 12 or 13. According to family, that was normal. Right? Because I did ask in the beginning, it's like, hey, does she normally understand? Does she do this? And she go, no, she has Alzheimer's. Well, when we were there, we got triage, and then we were waiting to get a room. Family members talking to patient, and I'm hearing the patient talking more. You know, and she's becoming more coherent as to like she's becoming aware, and it could be also an Alzheimer's stage, right? That comes in and goes. I mean, it was strange, and so I made a comment to my partner. I was like, "Man, do you notice like she improved?" And she goes, "Yeah, I noticed that. Like she was having like almost full blown conversations with her daughter." And then I asked the daughter, "Is like, do you see her normal?" And she goes, "Actually, she's a lot more than she really is." So that's what stood out from that call was that you know sometimes when you ask for family members information, right, like, hey, you know, what is her normal, sometimes that's not even normal, you know, because obviously she improved, and then they made a remark like, actually she's doing a lot better than what she normally is. So it was one of those calls that really stood out in that sense, that kind of taught me like, hey man, like, you know, you can't really go based on what people tell you. You have to medically investigate yourself, since you have more knowledge of medical stuff, right? What it's, you know, you can go base what they're telling you, but normal is normal in the sense of medical stuff, and you know what normal is, and how to find that normal, and then and the alternative is find that illness, right, as well. So I don't know, it just really stood out to me, and like I said, it wasn't, to me that's a simple call, right? Even though it is dangerous, right? To everybody else, it's like, holy shit, that's dangerous, right? That's a critical call, or that's a bad call, in that sense that, hey, somebody was sick, that's sick. But to me, I mean, when you deal with so much shit, to me it's a very simple treatments. The only thing that was interesting was just towards the end, the huge improvement of the patient, and obviously we did our job. And but yeah, that's pretty much the call. Thanks for watching. Thanks for supporting me. And any comments, any questions, leave comments, and I'll answer as I see them. And take care, and see you guys later.